So neonatal abstinence syndrome is, again, related to medications or substances that were ingested while baby was inside of moms that can cause secondary harmful symptoms. So some of those symptoms would be just irritability or forms that, basically the baby will show signs that they are withdrawing from that substance, which can present in 10, 15 different ways. The main thing we worry about is seizures. So if we see significant signs of symptoms before they have seizures, we like to intervene pretty rapidly.
They're very agitated, very flailing, very cry nonstop. But other systems they withdraw from. They don't feed well. They get diarrhea. They get terribly sore butts from the diarrhea. So it affects not just their neurologic status, but their whole body withdraws from it.
For withdrawal, we know about most infants before they're delivered that they've been exposed to opiates. If for some reason we don't know and we suspect it, there are very obvious signs such as tremors, they have a tight tone, they're irritable, high-pitched cry. So we're able to use the Finnegan scoring system, and that's very specific to NAS infants. And that is several different things that we assess for, and then they're scored and given a total. So based off the scores, we're able to tell, okay, they're showing some symptoms, or no, these are just normal newborn symptoms.
So what do we do for neonatal abstinence syndrome when they do show signs of some withdrawal? So most of the time, when we get numbers like 90%, we know not all 90% of those patients require medications. Some of the most beneficial things we can do is to create a non-stimulating environment. That would be really skin-to-skin contact with the moms without exogenous lights. Have a nice quiet or white noise type environment. So without, blaring sounds and alarms and bells. So quiet, dark is kind of the most important things we do. Regular feeds and skin-to-skin contact with moms is essential for decreasing scores and making sure that baby feels like they're comfortable. I think of skin-to-skin contact with moms as creating that perfect spa created specifically for that infant, right? That baby knows your heart rate, knows your pheromones, feels your skin temperature. Everything about that mom to that baby is perfect for a spa. So they're relaxed in that sense.
We really encourage breastfeeding here. It's one of the most important things you can do for your baby. When mothers who are on opiates breastfeed, they're actually giving their infants tiny amounts, and that actually helps them withdraw and helps them go into a smoother state. Breastfeeding is also great for bonding. And it is the best thing to help them grow. So we do pretty much full care when the parents aren't there. We bathe them, we assess them, change their diapers, feed them, swaddle them. We do a lot of hands-on care, and we also have cuddlers come in and do care as well. But we're pretty much the moms when the moms aren't there.
If a woman comes in and she identifies as using any type of opioid, whether it be prescription or non-prescription, we discuss with them the different options that they have during the pregnancy. One of those is we have a program that we've created called the Growing Hope Program, which is to help with education during the pregnancy for moms about what to expect during the pregnancy, during labor, and then after the delivery, also with care of the newborn, but what she should expect.
And one of the big parts of the Growing Hope program is we provide a centering education class once a week where we help teach the moms how to handle their babies going through withdrawal. We discuss breastfeeding, we bring in the neonatologist, nutrition, a doctor to discuss anything with pain. The nurses are available to help these moms during this class so that they can feel more comfortable delivering a healthy baby and being able to take their baby home. So we want moms to not be afraid to seek treatment, not be afraid to seek prenatal treatment, because they need to do what's best for their baby. And we're out there to help them, so they need to be aware that there's programs and services that can help them during their pregnancy to stay clean. I think one of the big things is that people are afraid to get help because they're afraid their babies are going to be taken away. And I think that's one of the stressors that we need to stress to them, that if they comply with our program and stay clean throughout the pregnancy, Child Protective Services doesn't get involved.
Every baby that we get to send home and have gotten through this is really a story. We remember them. The nurses really remember them because they get close, with some of the babies, some of the families. And it's those good outcomes that we remember that allows us to come back the next day when we have a bad day with a baby, whatever the case, whether it was bad medically and had a setback, or just a day where you could not console this baby that's withdrawing. So we really relish all of those experiences, to be honest with you.
Recovery starts with a call. Call 1-800-662-HELP or visit battlingopioids.org.